In our interview this week, the Executive Director of the National Primary Healthcare Development Agency talks about plans to set up a National Emergency Maternal and Child Health Intervention Center to address public health concerns on maternal, newborn and child deaths across Nigeria. Watch.
Dr. Faisal Shuaib, thank you very much for joining us on Dateline Abuja.
Thank you for having me.
Now, let's talk about declaration of state of emergency. It's worrisome. This issue we're talking about is one that has gulped naira in the millions. It's one that has been talked about several times. I'm talking about maternal and child health. We are ranked low in spite of all this seeming effort that have been put in this area. And today we're at a point where a state of emergency has been declared. How bad is the situation really?
The situation is actually very, very bad, right? So contextually, what it means is every day in Nigeria, we have 145 women who are pregnant or during childbirth lose their lives. We have 2,300 children dying every day. So if we were to liken it to a plane crash, that is a plane carrying 145 pregnant women who die every day in Nigeria. 2,300 children dying every day in Nigeria is equivalent to 15 plane crashes, if the capacity of the plane, of course, is around 145. Those are huge numbers, but they do not make it to the front page of our national dailies. It's not a topical issue. Compare it to when we had the plane crash in Ethiopia a few weeks ago. There was a global outrage about what happened. But every day in our communities, we have these numbers of women dying, we have these numbers of kids dying. And that is worrisome. This is why we're trying to raise the ante, to bring it to the national discourse. A lot has been done, a lot is being done by this government, as it were. But we're not doing enough if we're to achieve the Sustainable Development Goals by 2030. The rate at which we're reducing this mortality is not going to allow us achieve the Sustainable Development Goals. Just like we missed out on the Millennium Development Goals for reducing maternal and child mortality, we're on that same part, unless we do something drastic like to raise awareness, to bring it to an area where everybody knows this is happening and we have to do something different. It cannot be business as usual.
I'd like to take you on more on this state of emergency in the course of this conversation, but for now, let's go back. What exactly is the problem? Why haven't we been able to achieve all these goals that have been set? Why haven't we been able to reduce this significantly, if not eliminate it completely?
Right. For one, not enough resources have been plowed into reducing maternal and child death. Not enough resources are we getting in the health sector, especially around primary health care. At national level, President Buhari has committed funds, 55 billion naira, in the 2018 budget, just for primary health care, working with the National Health Insurance Scheme, the National Primary Healthcare Development Agency, 55 billion naira channeled directly to the health facilities to improve the functionality of primary health care. This is the first time in our lives that we've seen this kind of investment. And we hope that at the state levels as well, this kind of investment will happen. But beyond that, when you look at the landscape, we have so many actors, right, including our development partners, who are working in a fragmented silos, right? What we're trying to do right now by declaring an emergency and setting up a center that will coordinate all of this effort is to stop the fragmentation, reduce duplication, improve efficiency, and coordinate it in a way that we have one plan where everybody under the leadership of the federal government coordinates the efforts, right? And then at the state level, working with the traditional leaders, the religious leaders, the chief executives of the ministries of health, the state primary health care boards, we can work together in a way that is more urgent, in a way that is more coordinated, to ensure that we surpass historical trends, right? We do much better than anybody else has done when it comes to reducing the numbers of women and children that are dying due to perfectly preventable causes.
You talked about traditional and religious leaders besides money, perhaps then the argument that these factors, religion and culture, are probably impediments in achieving our target.
You're totally spot on, right? So because when we look at the health space, there are issues that are related to funding, the healthcare services that are provided. Those are called supply issues, right? On the other hand are the demand creation issues, the demand issues. You can have a health facility, but if somebody is sick and he doesn't go to the health facility, then, you know, we are back to a situation where you don't get health care, right? So going back to the communities, we are engaging with our traditional leaders, with our religious leaders, to mobilize communities, right, to the health facilities, to create awareness around the danger signs of pregnancy, around what they need to do to prevent malaria, to prevent pneumonia, to prevent diarrhea, which are the highest killers of our children, to encourage women to go for antenatal care. We cannot do this without our traditional, our religious, our opinion, and political leaders. This is exactly what we did when it came to polio. As you may be aware, 5 months down the line, if everything stays stable, we're going to exit as a country that is polio endemic, right? And that will mean the whole of Africa will now be removed from the committee of continents that is polio endemic. That is huge. The traditional leaders, the religious leaders were very critical towards achieving that. That is why we're bringing them on board and going back to the basics and say, if any woman dies in the community, we have to ask tough questions of the traditional leaders and say, how come we have now moved away from what we are known for in Nigeria, being our borders keepers, right? How come in a community a woman was bleeding and the community leaders were not there to ensure action, to move her to the health facility, whether that is a primary health care center or a secondary health care center?
Let's dig deeper into this national emergency. Let me get the name correct. National Emergency Maternal and Child Health Intervention Center. That's what it's called.
Right.
What is it going to do totally different from what we had in the past?
So first and foremost, right, there's going to be enhanced coordination in a cohesive manner.
Has that been a problem?
Absolutely.
Before now?
Absolutely. That has been part of the problem. So everybody doing his own little bit, right? So one development partner, for example, comes, takes 3 LGAs, right? Does very wonderful stuff. But after 2-3 years, the project ends. There's no sustainability. And there is no learning. But now, under the leadership of government, we want sustainable interventions. We'll learn from all the interventions that have taken place, from the pilot studies, from the small studies, now harmonizing them so that there's ownership from the community level all the way up. So sitting together, all the partners involved in trying to reduce maternal and child deaths, sitting down, agreeing on one plan, agreeing on those high impact interventions, and deploying our resources in one way, in a way that is transparent. As government, we put our funds on the table and say, this is what the federal government is going to contribute in terms of domestic resources. Development partners, donors, how much are you bringing to the table? We're now moving from a situation where in the past there have been a lot of strategies, frameworks that were developed, but no execution. What the center will do is deliver on what the strategies are. So for everything that we say we're going to do on the work plan, we're going to put a timeline and ensure that we actually deliver against specific targets. So in the next 2.5 years, what we're committing to, what we're telling Nigerians is that we have an ambitious plan to reduce by half the number of women and children dying from preventable causes.
Dr. Faisal Shuaib, thank you very much for coming on Dateline Abuja.
Okay, thank you.
Well, thank you for emails and tweets as always. Keep sending in your views and comments using the email address and Twitter handle on your screen. Also, be sure to share anything happening within your locality. Don't you forget, you can view the program on youtube.com/channelsweb/videos. Thank you for watching this week. I'm Gloria Umezuki. See you again.